it's not a very traditional story, I guess, but my husband is an endocrinologist and he chose Duke for his endocrinology fellowship because of one, the unique setting in the Durham, North Carolina, two, because of the awesome faculty that he has and mentorship that he has. But before he decided to come to Duke endocrinology, he wanted to make sure that I would be willing to come here for Duke Reproductive Endocrinology and Infertility. And, I looked at the program and I was very impressed by the breadth and depth of the fellowship experience, by the faculty and their expertise. And I was really excited about potentially being a Duke REI fellow. And so I said, yes, you can rank it your number one, and I will try my very, very, very best to get there along with you. And thankfully we did. So it was my number one program for a really long time. Started back in the beginning of the fellowship process, and I guess I have a unique perspective because I was able to measure every program against Duke and kind of see what the benefits were and compare it to a lot of other programs. And ultimately, I'm very, very happy of where we decided to go. My favorite part of being a Duke REI fellow is when a patient that you've seen since the first day of fellowship that has gone through months of treatment, they finally get pregnant and you maybe get to be involved in their retrieval or transfer, and then you get to do their OB ultrasound, and then they graduate, go to obstetrics and have a baby, and they come back and bring the baby around to the clinic. And it's something that you only really get to experience here at the Duke Fertility Clinic, because you get to have an intimate relationship with them and they really view you as one of your physicians. The clinical experience is, and during your first year, is your mostly monitoring clinic where you get to do the ultrasounds for the patients, and that's how you get really good at your ultrasound skills, get to hone those skills doing retrievals and helping out with embryo transfers and hysteroscopies that we do in the clinic. And those are your kind of main tasks for your first year. You also get to run your own SIS clinic, which you get to do the saline sonograms and then the counseling afterwards, which can be really helpful to kind of give patients news and learn how to do so in an efficient and kind and compassionate manner. In your third year of fellowship, we tend to see more patients in addition to monitoring clinic. And so as we develop our own clinic, we become more confident in seeing our own patients, making their treatment plans, making IVF orders with the help, obviously, of an attending physician. But you get more and more confident so that by the time that you graduate, it's not the first time that you're ever, writing orders for an ovulation induction cycle or IVF cycle. You feel very comfortable in doing those orders, that counseling, getting to see a patient who maybe didn't have the results they wanted from a first IVF cycle, or getting to see your own patient graduate and become pregnant. The research experience at the Duke REI program is what you make of it. So you have 90% protected research time, and you get to pick wonderful mentor. Most people do bench work or lab work because we have so many great mentors in that area. But if you wanted to do something more clinical, you could also do a clinical project if you wish. Because you have a lot of unstructured time, which is kind of unique for the second year, and you have such a long period of time, you can also do some of the things that are more interesting to you. So what I chose to do at that time is I chose to do more surgeries that I wanted to get better at. And I chose to spend that time working with the MIS department doing those surgeries. Obviously, you have to schedule that accordingly, but if you were more interested in doing pediatric adolescent gynecology, you could spend more time in those clinics, or like menopause medicine or something like that. Then you could definitely use that time for your own interest and to kind of expand your clinical horizons. You also have enough time to do smaller clinical projects or work with other departments. I mentioned my husband's in the endocrine department, and he does some of the transgender medicine research And so we work and collaborate together on some projects like that. So if you're lucky enough to be a Duke REI Fellow, you will be surprised at how congenial and loved you will be as the Duke REI Fellow, or especially as a first year's fellow, that we will, it can be kind of intimidating to be the first year fellow, but I always felt that they welcomed me with open arms. Not only will they always have your back, but they will support you in every way possible. I knew that whenever I graduated fellowship that I would want to be in a clinical space where I could focus on patients and be supported by my fellow senior faculty in creating what is the best plan for the patient and not motivated by any other external factors. When I started fellowship, I wasn't sure where I would end up. And what I did know, though, is that I love working with patients. And what the Duke REI program allowed me to do is work with patients all the time, so much so that I actually kind of missed it my research year. And I got to have really personal relationships with them. And so when I was trying to decide what I would do after fellowship, I knew that's what I wanted. Because I got to have such a great experience here working with patients that I knew that I wanted to spend most of my time in a clinical space and get to do that in a place where I would be supported